Mental illness has, by nature and cultural standards, been considered a weakness in the past. However, we now know that the true cause is a chemical imbalance in the brain. It truly is a form of disease just like diabetes. We're here at the Banyan Treatment Center in Boca Raton, Florida, with Rob Cole, Clinical Director of Banyan Mental Health Services.
Thanks for having us, Rob.
Thank you.
Now, this is actually a relatively new treatment center here. Now, mostly Banyan. There are other Banyans throughout Florida that are just treatment centers, correct? Now, this one in Boca focuses more on mental health, right?
This one focuses on both, actually, substance abuse and mental health. So this particular unit is strictly for mental health, and we do have a substance abuse unit and detox unit downstairs.
Unfortunately, there's still a negative stigma associated with the term mental illness in society. For example, many insurance companies won't fund treatment for someone diagnosed as mentally ill. Why do you think that is?
I think it's lack of education. There's a lot of misunderstanding, when it comes to mental illness. Defining mental illness, a lot of people don't know what that means. Mental illness just in and of itself sounds like the homeless person on the street who's talking to themselves. And I think there's this generalized picture of somebody with mental illness like that, when mental illness is far more than that.
It's a huge spectrum,
Huge spectrum, huge spectrum.
From basic anxiety disorders, where someone may have their life slightly impaired, all the way to paranoid schizophrenia, which is often more severe in financial, social, and vocational life impairments.
Talking about anxiety and depression also as being someone that would come to the treatment center. But how do you know what differentiates seeking treatment for versus just somebody going through a little bit of anxiety at home or what I would say is normal depression?
Yeah, there are situational events that, can happen. Somebody loses a job, they might feel anxious or even depressed for a period of time. But it wouldn't be considered a diagnosable form of depression, say major depressive disorder, without meeting specific criteria that's listed in the Diagnostic and Statistical Manual. So those specific criteria would have to be defined and over a period of fixed time to determine whether or not that diagnosis is actually something such as major depressive disorder.
And you're also a dietitian, so how important is diet and nutrition?
Diet's critical. I mean, we're finding out more and more each day about the effects of diet on brain activity. For example, we know that omega-3 fatty acids are critical for brain function. There's even some studies out that suggest that omega-3 fatty acids can help with bipolar disorder, possibly with depression. There's still more research that has to be done in that area, but it's very compelling at this point.
Medications can be a useful tool for people with mental illness if they are taken properly.
It's important to get the right key for the right lock.
Sure.
And sometimes that takes a little bit of time in terms of having trials on different medications to find the right key for your lock.
And do you think the goal ultimately is to get people off of medication through therapy, or are there some cases where they're absolutely going to need to be on medication?
I think there are cases where people have to stay on medications a long time. And a lot of people have concerns. A lot of clients will have concerns about that. And I really equate it to any other type of a medical condition. If you had diabetes, since we're talking about chemical imbalance, if we were talking about diabetes, would you say, I'm not going to take my insulin?
No.
No. And so it's just a different part of the body where the chemistry is awry. I think when you apply a medical model to it, a lot of people identify with that, and they feel more comfortable with the reality that this is chemistry.
Would you say that there's a typical client that would come to you? Obviously, you have individuals that you would take and treat in the center and others that you couldn't help. Yeah. So is there a typical patient?
I wouldn't say there's a typical client. That's a good question. I would say that there's a broad range of clients. There are some clients that may not benefit from this particular level of care, so we would want to make sure that we referred them to a specific level of care that would be more appropriate for them.
As mental illness and substance abuse affects people of all ages, races, genders, and socioeconomic levels. Matthew is an alumni of the Banyan Treatment Center.
I came to Banyan to be a part of their intensive outpatient and their outpatient program. I had just been getting out of a pretty serious state of psychosis. When I got to Banyan, I was still needing, basic therapy, group sessions, having a place to be more active in AA and kind of be accountable to someone other than myself. for a period of time.
Matthew says he attended group therapy 3 to 4 times a week, but the most useful part for him were the one-on-one therapy sessions with his counselor.
That really gave me time to talk to somebody not only about what I need to do to keep myself mentally stable, but what I need to prepare for when I get out. And that looked like, how I need to go apply for jobs, how I need to start putting in my applications for school, and really what I need to do to be able to leave Banyan and actually remain sober and mentally well.
Initially, Matthew didn't want treatment. He was court-ordered. But he says that he is so thankful he completed his therapy at Banyan because it saved his life.
I never really thought that I would be anything more than a drug addict. And even though I doubted the process and didn't believe in it and struggled through it, at the end of the day, I wouldn't have it any other way.
Allison Sirianni is the National Director of Public Relations at Banyan Treatment Center.
Banyan Treatment Center offers mental health treatment for adults as well as substance use disorder treatment. The difference between the mental health program at Banyan and a hospital setting is the level of care. So we treat people with mood disorders, thought disorders, schizophrenia, bipolar, anxiety, people with high psych needs. And they're not in a lockdown facility, which is typically what you'll find in a hospital setting. It is 24-hour security, and we have nursing available, but they're consenting adults. They can come and go as they please. Banyan Treatment Center does accept commercial insurance, private insurance, and we always do a free verification of benefits check. If you or a loved one are struggling with addiction or mental health disorders, it's never too late to get help. We are always available 24/7. Just call the number below this screen or visit www.banyantreatmentcenter.com.
Kalia Brisson is the clinical director of the Banyan Substance Abuse Facility in Boca. Something that we cover on the show all the time is the opioid epidemic.
Yes.
Let's get into that a little bit, because you had told us off camera that a really high percentage amount of the people that seek treatment come in for opiates, correct?
Correct.
Now, why do you think there's been such an explosion in opiate abuse and addiction in the past, say, decade?
I think that there's been an explosion of opiate dependence because of the pain mills that were down here in Florida, especially in in the Southeast. A lot of people that had chronic pain, whether they had children in the house and their children found these pills in the cabinet or they used them for themselves. There was so much access to pain medication, and when legislation took those pain mills away, we were left with a population of dependent people.
The body builds up an immunity to opioids over time, causing a person the need to take more and more just to get the same effect.
Even if you take them as prescribed, you're going to feel extreme flu-like symptoms when you stop taking them. And of course, our body goes into a state of distress when that happens, and we want to fix that.
For people who might have issues with addiction or mental illness, things like that, that might be looking into a facility, or family and friends of someone who might be trying to guide someone into checking into a facility like this, let's quickly touch upon sober houses, which is another topic that I just learned about. Senator Marco Rubio here in Florida actually asked the federal government to help crack down on some of these, because they're wrought with fraud.
Right.
They're just giving out prescriptions and things like that to the patients
Right.
that are causing overdoses and deaths and fatalities. So the public has become a little skeptical about the legitimacy of some of these facilities. Obviously, Banyan, not one of these sober homes, but
Yes.
tell us the differences.
Banyan is not a sober home. There's a big difference between a treatment center and a sober home, and the biggest difference is accreditation. So Banyan is accredited by the Joint Commission and by DCF, and we get regular audits, and we are, really functioning at the most ethical level.
Banyan has staff on hand 24 hours a day, 7 days a week, whereas a sober house is more of a peer support environment. Sober homes are simply homes where sober people live.
The idea is that if you are surrounding yourself with a community of positive people that are doing the same thing that you're doing, it could be a great experience. However, if you don't go to a reputable facility or a sober home, you're facing the possibility of there being some exploitation or something along those lines.
If a sober home is needed, Kalia suggests deferring to a treatment center for a recommendation of somewhere reputable.
I actually know people, I've had acquaintances and peers, even family members throughout the years that have kind of gone in and out of certain detox rehab centers and things like that. And a lot of times they just don't work. What do you think the key is for someone who, first you have to want to be helped,
Absolutely.
most likely, but then how do you stick to it?
It's like any lifestyle change. If you want to lose 100 pounds and maintain that loss, how do you do that? Consistency, dedication. It takes the exact same qualities to make any sort of lifestyle change as it does to make this one, which is sobriety.
Well, thank you for making
Thank
such a
you.
difference in so many people's lives.
Thank you. I mean, I'm really happy that I get to do this every day.